Medical emergencies in space, the challenges NASA doesn't talk about. This week's ISS medical evacuation made history, but it also raised a question most people don't think about. What happens when someone gets sick or injured in space? The answer is more complicated and more fascinating than you might think. Let's talk about the medical challenges NASA faces 250 miles above Earth and why keeping astronauts healthy in space is one of the hardest problems in human spaceflight. First, let's talk about what is available aboard the ISS. The station has a comprehensive medical kit, essentially a floating emergency room. It includes basic diagnostic tools, stethoscope, blood pressure cuff, thermometer, pulse oximeter, medications, pain relievers, antibiotics, anti-nausea drugs, cardiac medications, surgical supplies, scalpels, sutures, sterile dressings, dental kit for emergency tooth repairs, defibrillator for cardiac emergencies, ultrasound machine. For imaging internal injuries, astronauts receive extensive medical training before launch. They learn how to take vital signs, administer medications, perform CPR, even do minor surgical procedures if necessary. And they have access to telemedicine, real-time consultations with flight surgeons on Earth who can guide them through procedures step by step. But here's the problem. Space changes everything. In zero gravity, medical procedures that are simple on Earth become incredibly difficult. Blood doesn't flow down, it floats. If you cut yourself, blood forms spheres that drift through the air. Performing surgery means dealing with floating fluids, floating tools, and a patient who won't stay still without restraints. IV fluids don't drip. They have to be pressurized to enter the bloodstream. CPR is nearly impossible because you can't get leverage without gravity. Even something as basic as swallowing pills is harder when liquids don't flow the way they're supposed to. And then there's diagnosis. The ultrasound machine can show internal bleeding or organ damage, but there's no CT scanner, no MRI, no X-ray machine. If you need advanced imaging, you're out of luck. NASA doesn't publicize every medical issue that occurs in space, but there have been close calls. During the Apollo 13 mission, astronaut Fred Haise developed a severe urinary tract infection. The crew was already fighting for survival after an oxygen tank explosion. Haise's infection, combined with dehydration and hypothermia, nearly killed him. He made it home, but barely. On Mir, cosmonaut Alexander Balandin developed a dangerous heart arrhythmia. His heart was beating irregularly, and doctors on Earth couldn't determine the cause. He was given medication and monitored constantly. The arrhythmia eventually resolved, but if it hadn't, there was no way to get him home quickly. On the ISS, there have been reports of kidney stones, dental emergencies, eye injuries, and psychological crises. Most were managed on board, but some required close monitoring and raised serious questions about what would happen if the situation worsened. One of the biggest long-term medical threats in space is radiation. On Earth, we're protected by our atmosphere and magnetic field. In space, astronauts are exposed to cosmic rays and solar radiation, ionizing radiation that damages DNA and increases cancer risk. ISS astronauts receive about 50 to 100 times more radiation than people on Earth. Over a 6-month mission, that exposure adds up. Long-term effects include increased risk of cancer, cataracts, cardiovascular disease, and neurological damage. There's no cure for radiation exposure. The only solution is shielding, and the ISS has limited shielding. Future deep space missions will need better protection, but current technology can't fully solve the problem. Space is isolating. You're confined to a small environment with the same people for months. You can't go outside, you can't go home. Communication with Earth has delays. The mental toll is real. Astronauts are screened extensively for psychological resilience, but even the best prepared individuals can struggle. Depression, anxiety, interpersonal conflicts, and acute stress reactions have all been documented. The ISS has a psychological support program, regular check-ins with psychologists, access to private communication channels, care packages from home. But if someone experiences a severe mental health crisis, the options are limited. There's no psychiatric hospital in space, no sedative strong enough to handle a serious episode. And if someone becomes a danger to themselves or the crew, evacuation is the only option. Now let's talk about the elephant in the room, Mars. A trip to Mars takes about 7 months each way. Once you're there, you're committed. If someone gets sick, injured, or develops a serious medical condition, there's no quick trip home. You can't evacuate from Mars. The launch window only opens every 26 months when Earth and Mars are properly aligned. If you miss it, you're stuck for 2 years. That means future Mars crews will need to be medically self-sufficient. They'll need a trained doctor or paramedic aboard advanced diagnostic equipment, portable X-ray, CT scanner, lab equipment for blood tests, surgical capabilities, a sterile operating environment, anesthesia, surgical tools, extensive medical supplies, medications, blood products, IV fluids, psychological support, therapists, psychiatric medications, crisis intervention protocols, and even with all that, some medical emergencies simply can't be handled without a hospital. Appendicitis, heart attack, stroke, severe trauma. If one of those happens on Mars, the crew member might not survive. This raises a difficult ethical question. Should we send people to Mars knowing they might die from a medical emergency we could have treated on Earth? NASA's answer is yes, but only if we've done everything possible to prepare. That means better screening, better training, better equipment, and better protocols. It means accepting calculated risks and being transparent about those risks with the astronauts who volunteer. Space exploration has always involved risk, but medical risk is different. It's not a rocket explosion or a systems failure, it's a human being suffering from something preventable, treatable, or survivable, if only they were closer to home. This week's ISS evacuation reminds us that space is unforgiving. NASA can monitor astronauts 24/7. They can provide excellent medical care. They can execute a controlled evacuation in under 24 hours, but they can't eliminate the risks. And as we push deeper into space, those risks will only grow. Medical preparedness isn't glamorous. It doesn't make headlines like rocket launches or rover landings, but it's one of the most important challenges we face in human spaceflight. Because if we're going to explore the cosmos, we need to keep our explorers alive. Like, share, and subscribe for more deep dives into space challenges. And as always, keep looking up.